Hello, so today we are going to be introducing our part-time and online Masters in Transformative Oncology. For those of you who don't know me, I'm Hazel and I am the course advisor for this program. So I'm here to help you at the pre-application and submitting your application stage, and I'm here to answer any questions and help get you more information about the course. Today I'm joined by Dr Suzanne Johnson and we're going to be introducing the program to you. So I'm going to hand over to you, Suze.
Thanks, Hazel. Hi, everybody. So today's session, really, we're going to talk a little bit about the course as a whole. So answer some of those questions that I expect some of you are thinking about or wanting to know answers for if you're thinking of applying for this programme. Things like, what does the course cover? What skills will I learn? What makes the course unique? And of course, is this course right for you? And then we'll move into a focus on Unit 1. So understanding the challenges of tumour biology, and we'll go through some of the learning outcomes and what and how you will learn, and also some of the assessments. So it's no surprise and it's no secret that cancer is a global concern. It's a leading cause of global morbidity, disability and mortality. And in 2020, over 19 million people were diagnosed with cancer, resulting in nearly 10 million cancer-related deaths. Since then, and made worse by the pandemic, there is global acknowledgement that the lack of oncology workforce has and will continue to have a detrimental impact on patient outcomes and overall population health. It's important to recognise and acknowledge that cancer is an extremely complex collection of different diseases, and it's a field which is rapidly evolving. So what is transformative oncology? This programme has been devised to provide education around understanding the underlying biology of cancer, but also to give an appreciation of the diversity of individual tumours and different tumour types, and also patients. And it's about achieving better outcomes for patients with cancer through collaborative working, innovation and translational research, and building those multidisciplinary teams which bring in the innovative approaches and a holistic approach to develop personalised strategies for cancer treatment. So what does the course cover? The first unit is around understanding the challenges of tumour biology. And this really aims to give an appreciation of tumour diversity and how this can impact different detection and treatment strategies. The second unit focuses on cancer as an individualised disease. So this is about appreciating that both tumours and patients with cancers are individuals. And by gaining an understanding of how underlying health, genetics and lifestyle choices can contribute to individual cancer cases, risk, responses to treatments, etc. In the third unit, we start to look at both established and experimental therapeutics and outlining both the present and future cancer treatment strategies. So moving towards treating every cancer and every patient individually. And in the fourth unit, we look at the branches of oncology. So this is really an introductory overview to the approaches to treatment across the board in oncology. So whether it's surgical oncology, medical or clinical oncology, and how these different specialities intersect and work synergistically for the best outcome. Moving on to the fifth unit, this is all about the science of radiotherapy. So it's really gaining an understanding of one of the cornerstones of cancer treatment. Then we move on to strategies for early detection. And here we start to discover really how effective screening mechanisms and the use of medical imaging tools and technology can really emphasise the advances in early detection of cancer. As we start to talk about the principles of personalised medicine, this is really about gaining a fundamental understanding of the steps that are required to realise precision oncology. And the final short unit is around delivering the best cancer care. So ways to establish a really efficient and effective clinical pathway to deliver optimal results to patients with cancer. And if you're interested in continuing to achieve a master's, you can do this by either completing a clinical practice-based placement or maybe a wet lab or database research project. Or if you want to continue your learning online, we have a research skills and practice unit, which is contextualized with oncology background. And within this unit, you will learn the skills such as formulating a research question, skills in communicating your research, and also designing study methodology. So ultimately, what skills are you likely to learn? So the ethos of the programme is really to deliver training and education with transferable skills, which will enable you to continue to learn in your journey and throughout your career. So it's really emphasising the importance of intellectual curiosity, creative and critical thinking. So to incorporate technology and innovation throughout the cancer pathway. So it's looking at your current practice and asking questions. Can this be done better? Do we need advice from other disciplines? Who can we talk to about that to make this flow more efficiently? We really emphasise the importance of reflective practice throughout the programme. So really understanding that research priorities and the clinical applications all lead to really effective decision making in the context of cancer. And it's about understanding how research and inquiry are used to create and interpret knowledge in the field of oncology. And this is something that happens throughout the entire pathway. And again, very important to introduce and champion the real power of an interdisciplinary approach to expedite the early detection of cancer, which ultimately leads to better outcomes for patients. So what makes this course unique? It's designed to be very agile, it's designed to be medically applicable and inspirational. And importantly, it's designed to reflect the changing needs in healthcare. And this is something we've absolutely seen in the course of the pandemic. It involves medically applicable education, which is important because it brings in that innovative research, the understanding of treatment and therapeutic strategies and approaches, and all the way helping you to understand how to achieve effective personalised cancer care. And importantly, you'll gain the added value from hearing from real-world case studies and the interconnected thinking from Manchester's world experts. And a real advantage of the programme is how to benefit from engaging with your peers. So through community of practice and engaging with the other students on the cohort, who each will bring a rich global experience to help to deepen and further your understanding. So if you're still asking the question, is this course for me? In 2021, ESMO, which is the European Society of Medical Oncologists, stated for excellence in cancer care for the 21st century, there needs to be the intervention of multiple skilled healthcare providers. So these are from anatomical pathologists through to medical and paediatric oncologists, surgeons, oncology nurses, and all the way through to radiation oncologists and technicians. And actually, this can be extended also to include research scientists and other allied healthcare professionals such as nutritionists, physiotherapists, or pharmacists, all of whom have key roles in transforming outcomes for patients. The programme is delivered in a really agile and flexible learning platform. So you can access it part-time whilst working, or perhaps you're looking to upskill before you return to work. And it's developed to appeal to a global audience. So it's available to you regardless of your time zone. And as we've mentioned before, your learning will be enriched by the sharing the experience with diverse peers. And this is because people will be working in different job roles, they'll have different perspectives on decision making. The institutes in which they work will have different facilities available and treatment options available, which all influence the decision making.